Welcome to the Abbott Diabetes Care training for the FreeStyle Libre system. In this training, we will provide an overview of the FreeStyle Libre system, key details to help educate patients on getting started with the device, and ordering information needed to fill prescriptions. Before we begin the presentation, please take a minute to read the FreeStyle Libre system indications and important safety information. For those of you who may not be familiar with continuous glucose monitoring, or CGM, CGM provides a real-time way of measuring glucose levels without finger sticks. A tiny electrode, which is part of the glucose sensor, is inserted under the skin to measure glucose levels in tissue fluids. The glucose information is transmitted to a reader that will display the user's glucose value. Data shows that 1 out of 3 patients comply with blood glucose monitoring as prescribed. Blood glucose monitoring only provides point-in-time readings and doesn't warn of pending hypoglycemia. Even well-controlled patients can spend significant time outside the desired target range. For the more than 30 million Americans living with diabetes, persistent self-management with glucose monitoring is a key strategy to improve glycemic outcomes. However, with traditional blood glucose testing, episodes of hyperglycemia and hypoglycemia could be missed, as illustrated in the 2 charts shown here. Patients who infrequently use blood glucose monitoring may not achieve optimal glycemic outcomes and may fail to detect hyperglycemia or hypoglycemic events. Patients may not be testing as often as required because of painful finger sticks and time-consuming testing, especially for those on intensive insulin. In addition, some patients may not be compliant to testing requirements due to the additional test strips required and associated cost. Introducing the FreeStyle Libre system, up to 10 days of glucose results and no finger sticks. The FreeStyle Libre Flash Glucose Monitoring System is a unique sensor-based personal CGM device indicated for the management of diabetes in adult patients 18 years and above. It is designed to replace blood glucose testing and facilitate treatment decisions, such as insulin dosing, in patients with diabetes. Unlike blood glucose monitoring, the FreeStyle Libre system does not require the patient to perform finger sticks. As the FreeStyle Libre system is factory calibrated, glucose readings are not dependent on any fingerstick BGM calibrations. The FreeStyle Libre system consists of 2 components, a reader and a sensor. With the reader, a real-time glucose level, a glucose trend arrow, and an 8-hour graph of glucose readings are displayed. The FreeStyle Libre sensor has to be scanned every 8 hours to track these glucose patterns, which can aid in the detection of hyperglycemic and hypoglycemic events. Patients can scan as often as desired, and the FreeStyle Libre device stores up to 90 days of data. Pharmacists can help patients manage their diabetes by helping to interpret readings and analyze glucose trends over time, which may provide insight for acute and long-term adjustments on patient therapy. The second component is a FreeStyle Libre sensor, which is small, discreet, and easy to wear for patients. The sensor can be worn for up to 10 days on the back of the upper arm. The FreeStyle Libre sensor has a thin filament, which is inserted on the back of the upper arm using a single-use applicator. The filament is less than 0.4 millimeters thick and inserted 5 millimeters beneath the skin to measure interstitial fluid. After a 12-hour warm-up period, the sensor automatically measures interstitial glucose every minute and can be worn for up to 10 days. The sensor is painlessly scanned by a FreeStyle Libre reader that collects immediate glucose measurements and provides trends from glucose readings recorded every 15 minutes. By using the information generated in the FreeStyle Libre summary glucose reports, patients can self-manage their diabetes and identify glucose levels above or below the desired range. Patients can understand trends in glucose levels throughout the day and night and identify factors that impact their glucose levels, such as food, insulin, and exercise. The FreeStyle Libre system is accurate, stable, and consistent over 10 days without the need for fingerstick calibrations. With the FreeStyle Libre system, there was a high degree of agreement between sensor readings and YSI laboratory instrument references. One measure of clinical accuracy is the consensus error grid, which is divided into zones, with Zone A representing the greatest accuracy. Zone A equals no effect on clinical action, considered clinically accurate. Zone B equals altered clinical action, but no or little effect on clinical outcome. 92.6% of FreeStyle Libre sensor glucose results fall within Zone A when compared to capillary blood glucose results. Within Zones A and B, 100% of glucose results were achieved. In clinical studies, patients more actively monitor their glucose results using the FreeStyle Libre system than self-monitoring of blood glucose. With type 1 diabetes patients in the IMPACT trial, glucose monitoring increased from 5.6 tests per day to 15.1 scans per day. This is approximately 3 times increase in glucose monitoring. With type 2 diabetes patients in the REPLACE trial, glucose monitoring increased from 3 tests per day to 8.3 scans per day. This also is approximately 3 times increase in glucose monitoring. As of May 2018, for a monthly refill of sensors, most commercially insured patients pay between $40 to $75 per month for eligible FreeStyle Libre sensor prescriptions at participating retail pharmacies. As for the FreeStyle Libre reader, most commercially insured patients pay approximately $65 for an eligible FreeStyle Libre reader prescription. We know that servicing Medicare patients is important to you. However, for those Medicare patients who qualify for therapeutic CGM coverage, the FreeStyle Libre system is currently available only through our DME suppliers. First-time customers will always need one reader with their first order of sensors. Each FreeStyle Libre sensor has a wear time of up to 10 days, and a typical month should consist of 3 sensors for a total of 30 days. Each package is sold in eaches, therefore 3 sensors should be ordered for a 30-day supply. For the FreeStyle Libre system components, the following items are included with each FreeStyle Libre sensor kit: 1 sensor pack worn for up to 10 days, 1 single-use applicator, alcohol wipes, and product insert. The following items are included with each FreeStyle Libre reader kit: 1 FreeStyle Libre reader, 1 USB cable and power adapter, system instructions including user's manual, quick start guide, quick reference guide, and interactive tutorial on USB drive. Pharmacists can order the FreeStyle Libre system from Amerisource Bergen, Cardinal, and McKesson. You can use the wholesaler order numbers on this slide to order both the FreeStyle Libre reader and FreeStyle Libre sensors. Patients will require a FreeStyle Libre reader to use the FreeStyle Libre sensors. When training your patients on how to get started, you'll find that it's easy for your patients to apply and use as seen in this video. First, patients select an area on the back of the upper arm. Second, on a hard and flat surface, patients prepare the sensor pack and sensor applicator. The sensor can be applied to the back of the upper arm using this motion. Lastly, to activate the sensor, patients scan the sensor using the FreeStyle Libre reader and wait 12 hours for their first glucose reading. After the warm-up period, patients can scan as often as they choose for painless glucose results. This concludes the presentation section of your training. If you would like to view additional resources, please visit pharmacy.freestylelibre.us. To complete the final step of training, you may advance to a short questionnaire. Thank you for your participation today and taking the time out of your busy schedule to learn about the FreeStyle Libre system.